Today we're going to be discussing a citation that the Illinois Department of Public Health issued to Montebello Health Care Center in Hamilton after a resident there suffered a broken hip in a fall. My name is Barry Doyle. I am a lawyer in Skokie practicing nursing home abuse and neglect work throughout the state of Illinois. I'm also the author of Built to Fail, a free report available for download from my website, which spells out how the nursing home business model inevitably produces unnecessary injuries and deaths for nursing home residents. When a resident has a fall, this is supposed to trigger a number of steps in the nursing home, among them being a revision of the care plan. When a resident is considered to have a fall anytime there is an unexplained change in plane. And when a resident is found on the floor without any other explanation, the assumption should be in the long-term care industry that the resident has in fact suffered a fall. In this particular incident, the resident was found on the floor one day without any explanation. He was sent to the hospital where he was examined, diagnosed as having suffered pneumonia. At this point, a revision of the care plan should have occurred once the resident returned to the nursing home. When a resident has a fall, one of the truisms in the long-term care industry is that falls tend to beget more falls. And the fact that a fall has occurred is an indicator that the care plan itself was ineffective in preventing a fall, and this should trigger a reevaluation of the effectiveness of the care plan and a change in the terms of the care plan. For this particular resident, this didn't occur. The resident continued to be assessed as a low fall risk despite having had a history of falls and having had weaknesses associated with the pneumonia. Without a revision of the care plan, a second fall was an inevitability, and in fact, another fall happened the very next day. In this particular fall, the resident was found on the floor yet again, this time complaining of pain in the hip. He was sent to the hospital where he underwent surgery to repair the hip fracture. There are a couple of shortcomings in the care that this resident was provided. First, the staff failed to recognize that the first incident where he was found on the floor was in fact a fall. Secondly, that there was no revision of the care plan that was triggered by that fall. And third, that the resident continued to be treated as a low fall risk despite having had a history of falls, which is again a risk factor for having additional falls. Any change in the care plan would have certainly reduced the risk of having had the fall where the resident suffered the broken hip. The failure of the staff to do so is an example of substandard care. I hope you've enjoyed watching this. My name is Barry Doyle. If you have any questions regarding this or any other nursing home abuse and neglect matter, please feel free to reach out to us. My number is 312-263-1080, or I can be reached on the web at www.accidentlawillinois.com. Thank you very much for watching.